Alright, in this video, we are going to look at the health issues related to the human musculoskeletal system. There are a few disorders that we will be discussing in this chapter, namely osteoporosis, osteomalacia, arthritis, rickets, and scoliosis. Okay, so let's look at the first one, osteoporosis. Okay, osteo means bone, and then porosis comes from the word pores, which means hole. So imagine the bones having lots of holes. So it definitely has jeopardized its function as a support system, and therefore this is a bone disorder characterized by weak bones. Okay, that the bones may break easily. Okay, so these are some of the we're going to look at it the next slide and to compare between normal bone and also bones of osteoporosis. So you get to see more pores here at this problematic bone of the osteoporosis. And this figure here is showing bone mass decreases with age, and that the symptoms include fragile bones, okay, reduced height, and also stoop posture. Okay, stoop posture as depicted here in this picture. So appreciate this is the normal curvature of the vertebral column, and as the person aged, you get to see that the curvature has changed in this manner. Okay, compare between the normal bones and also bones of osteoporosis patient. Okay, and this elderly person is having hip fracture because of osteoporosis. Just maybe slight fall will cause fracture of the bone. That means the bone is now very fragile. Okay, so this is a disease where the bone mass is reduced. Kurang dia punya kepadatan tulang. The bones become porous, lots of holes, and then lighter, usually in old people, particularly women who have gone through menopause. Because body of the postmenopausal women, they do not produce sex hormones, especially estrogen. So that means estrogen is very essential in that it is going to contribute to help in a deposition of these minerals, bone minerals. But once estrogen reduces, there will be the result is that more bone minerals are lost rather than deposited. Therefore, end up getting bones that are soft and brittle ataupun tulang yang rapuh. Okay, so causes insufficient calcium and phosphate minerals from the diet. Prevention is that to do weight-bearing exercises. Okay, to stress the bone. Okay, menjadikan untuk menambah daya tahan ataupun kepadatan tulang itu. Taking diet rich in calcium, phosphorus, and also vitamin D. Refrain from smoking. Okay, so more pictures here. Compare the normal bone osteoporosis and severe osteoporosis with lots of these pores ataupun lubang itu. Okay, chemicals in just now we mentioned cigarette smoke is very harmful. One of the risk factor that cause osteoporosis is because chemicals in those cigarettes can cause excessive multiplication of osteoclast. Okay, so what is osteoclast is that it will result in a dissolved of the bone tissues. That means dia akan mengurangkan kepadatan tulang. Hence, there will be rapid bone density lost. Okay, so this one examples of weight-bearing exercise. Okay, now moving on is the next disorder that we're going to discuss, osteomalacia, soft bone. Condition is because of lack of calcium, phosphorus, and also vitamin D, usually among adults, especially pregnant women. And it's called rickets if it is among the children. Okay, among the children, you call it as rickets. So rickets causes softening and weakening of the children's bone, resulting in bone defects. Rickets. Children. Right. Next one is arthritis. Okay, arthritis, which is a common type of arthritis that in the elderly, it is called osteoarthritis, which is caused by decrease in the synovial fluid, wear and tear of the cartilage in certain joints. These are osteoarthritis. Okay, so the cartilage, what happens, becomes thinner, ligament shortens, and even some of them loses its elasticity. So imagine the joints, such as the knee joints, become swollen, painful, and less flexible because of this. Okay, so it's going to affect daily activities. Okay, particularly walking because of the pain. So compare here this picture between normal joints and also deteriorating joint due to osteoarthritis. Okay, so what is actually arthritis? Whenever you see here this term, okay, it refers to inflammation. Inflammation of one or more joints characterized by swelling, warmth, redness of the overlying area, pain, and also restriction of movement. Comprises more than 100 distinct conditions, can affect any stage of life. Most common forms of osteoarthritis is mentioned in the previous slide. There's also RA, rheumatoid arthritis, and another one which is called gout. Okay, compare between normal and also RA, rheumatoid arthritis. Okay, you get to see here in between these two bones. Okay, remember the synovial fluid, synovial membrane. So what happened here? Reddish inflammation happens. Okay, that's the evolution of osteoarthritis. You get to see the bones, the normal ones, and then okay, these are the cartilage, which is encapsulating the ends of the bone. Thinning of the cartilage. Okay, what's left are those remnant ones, and the rightmost picture shows the destruction of cartilage, okay, in a severe state. Okay, this is a picture showing gout, uric acid crystals. Okay, masses of uric acids, tophi here at the end of the bone as well. So you can see inflammation. Whenever there is a swollen and inflamed joints, we know that it's a sign of inflammation, redness. Okay, redness and also swelling. Okay, so these are some facts related to OA, osteoarthritis, most commonly in older people. Top layer of the cartilage of the joint breaks down because of wear and tear. House, Okay, kalau RA, rheumatoid arthritis, because of the inflammation of the synovial membrane of the joints. Okay, it can be at these joints. Gout condition results from deposition of uric acid in the joints. Okay, aging. Decreased production of synovial fluid, where the cartilage between the bones becomes thinner and that the ligaments shortens. Even some of them lose their elasticity. I've mentioned just now. Okay, rickets is the softening and weakening of bones among children because of the extreme and prolonged vitamin D and calcium deficiency. So to prevent or the means of treatment is that consume food with high content of vitamin D, calcium, and phosphorus. Okay, you get to see this. Pembengkokan. So you see the bones are no longer able to support the weight of the body well. Okay, it results in these the bones no longer in a straight manner. There's a bit curve here. Okay, scoliosis. What is scoliosis? So that's the backbone of the scoliosis patient is bent to the side, so forming an S or the C shape when viewed from the back. So there's two conditions over here. May be caused by genetic factor or abnormal growth of the backbone during puberty development. Okay, so compare here between the normal individual and also the scoliosis patient, their vertebral column. Okay, notice the curvature. So from back view of a normal individual, you can get to see that it is straight. But at this back view of the scoliosis patient, you can see the vertebral column is no longer straight. Can you see the axis here? It's supposed to be straight like this, but then you see it has shown this type of curvature, which is abnormal. Okay, so let's look at practices to maintain a healthy musculoskeletal system. First, very important, and everybody can do this, is that we have to maintain good body posture. We have to wear proper attire, do exercise, and to have balanced diet. Okay, good body postures. Posture means what? Person's position, body position, when sitting, lying, standing, walking. So we should not slouch. That means we should not stand or move or sit in a lazy, drooping way. So we should sit properly, should sit straight up. Okay, or whenever standing also, we should not slouch. Avoid this because it is going to exert pressure on the vertebral column, hence might result in misalignment of the vertebral column. Okay, eventually, what's going to happen is that these may prevent circulation of the blood, suppressing the nerves and also vital organs. Okay, effects as a result of incorrect body posture when using smartphones. Headache. These are the effects. Okay, have you experienced these? Shoulder and also neck pain. Even the severe ones is breathing difficulty and back pain. Okay, next is proper attire. Wearing proper attire is very essential to wear proper, we say comfortable, loose clothing. Okay, so that means we shouldn't be wearing those tight ones lah. Otherwise, it's going to restrict our blood circulation and therefore affect our musculoskeletal system. Okay, and the shoes, very important. The best is with low heels, with cushions, those comfy ones. Okay, providing support and also preventing injuries to the vertebral column. So please take note. Right, exercise is very essential because it's going to help in blood circulation. Apart from that, it strengthens the joint structure, increases the flexibility of muscles, ligaments as we exercised, increase our body strength, bone mineral deposits among the adults, and also it is actually a prevention method, one of the prevention ways of this bone disorder, osteoporosis. Okay. Also, very important, last but not least, is to have balanced diet. To consume a balanced diet, especially food which is rich in milk because of the calcium content, minerals like phosphate, vitamin C, and also D, very essential in helping to absorb calcium into our body, and vitamin C is going to help in increasing the bone mass. Okay, we have come to the end of the chapter. We've discussed the types of skeleton. Okay, also we've gone through these human musculoskeletal systems, talking about the axial skeleton, also the joint structures. We had a long discussion on these, as well as the mechanisms and movement and locomotions of humans and other animals. And what we've just discussed in this video is on the health issues related to the human musculoskeletal system.